So at Heartland Health, having the expanded rooming and discharge protocols has given us kind of a standard approach to taking care of patients, which means that we can have common expectations, we can share responsibilities equally, and I think we can provide a more consistent patient experience. What that looks like for us starts even before the patient comes into the room at the beginning of the day. We take some time to look at our schedules to see what the outstanding needs are for patients. What are some of those point of care labs that need to be drawn? What are some of those preventative measures and outstanding referrals that need to be addressed? When patients come to our clinic, they're given a form that provides them a list of their medications, kind of the key points that exist in our electronic medical record, and we ask them to review it before they see us so they can see if there's anything that we are missing or gaps of care or gaps of knowledge that we don't have. And that allows me to understand both what patients say and also the way they say it, which I think is crucial in providing good patient care. Healthcare is very complex, and anytime you go into a clinic or into a medical setting, it can feel very overwhelming. And so having someone essentially walk you from the waiting room through your entire clinic journey until you're out the door. Typically, when we do any sort of chronic care management, we try really hard to have our patients receive a year's worth of medications at one time. So for us, that's 3 months with 4 refills. Some of that comes when inside the clinic, making sure that every time we check the medications, making sure that there's something that's, that our medication lists are up to date. We've spent a lot of time thinking about how do we set up our electronic health records to default to 90 and 4, meaning that a patient can get a 3-month supply or 90 days at a time and knows that they will have enough refills to last them for 12 months or essentially a year. It just makes it that much easier to set up our patients so they get a year's worth of medications. Healthcare is confusing. Pharmacy is confusing, and I think patients sometimes get overwhelmed when the medication that they were told was important and for them to take every day all of a sudden no longer is available to them. So feeling confident that they have the medications they need when they walk out the door means that we don't get calls when that expectation isn't met. That means less resources spent by our nurses. It means less time spent talking to pharmacies, and it means more time that we can spend taking care of patients for the things that matter most. Optimizing the prescription renewal process has allowed our patients to take the medications they need without the barriers of having to go to the pharmacy and struggle with why those medications aren't there in the first place. One, I think it gives you kind of a sense of support. 2, it gives you a reference point if things don't make sense, or if you have questions, you know that you can talk to the person that's with you. And then 3, I think it builds relationship, and I think relationship is everything. So, and I think it's everything for the patient, and it's everything for our teams. We all come to medicine because we want to help people, and I think we fail to recognize that same experience exists for our care team members as well.